And good evening. Thank you so much for joining us for today's Community Telephone Town Hall. My name is Zoelle Stackhouse, and I'm the Special Assistant to the Deputy Chief of Staff of Mayor Muriel Bowser. We want to make a note that on Monday, Mayor Bowser announced an extension on the ticket amnesty program. Please visit ticketamnesty.dc.gov for more information. And as always, please visit coronavirus.dc.gov to review the most up-to-date COVID guidances. Today, we are once again joined by Chancellor of DC Public Schools, Dr. Louis Farabee, who will be providing an update on DC Public Schools COVID protocols. This is the first of 3 telephone town halls on this subject, so please be sure to follow along. Before we get started, I'd like to remind everyone that if you would like to ask a question at any time during the call, you can press 0 and you will be added into our speaker queue. And now I would like to pass it over to Chancellor Dr. Farabee.
Good evening. Thank you. I am Louis Farabee, Chancellor for the District of Columbia Public Schools, and welcome and thank you for joining us this evening. We're looking forward to chatting with you more this evening today about our COVID case response protocols. In other words, how are we addressing COVID cases in our schools, including reporting, investigating, quarantining, and communicating. We know that families are very much so interested in getting more information on these key topics. Today, I have a few of my colleagues to help explain where we are and what our strategies are. I'm pleased to introduce our panelists that will be presenting tonight, Dr. Brent Elliott, who leads our student support work, including our health services team, Jessica Jennings, who leads our communication work, and Corey Cogan, who oversees everything in teaching and learning. Again, tonight we will share more about how we are responding to COVID cases. But before I do that, I want to give everyone a warm welcome to the start of the 21-22 school year. We're so excited to see the joyful faces, the engagement with our students on our campuses. And as you all know, our doors are open and our schools are full, students are learning, and we have amazing staff that is creating a safe and engaging environment. It's what has brought me so much joy to see so many of our students, our educators, our families back in school this year. And we're excited that all of our students are back in school every day. And we know that the best place for our students to learn and build connections is in school, in person, with their teachers, classmates, and mentors. I'm also appreciative of our dedicated and committed DCPS families and staff who've been with us last year and throughout this year in the summer to ensure that we're doing everything possible to get our students back in school and to keep them in school. I know for families, this school year feels very different, and I recognize that. And we want our students and our staff to feel comfortable. And we're working hard to ensure that our new routines are embraced by all. Now, let's dive into the topics tonight. It's my pleasure at this time to turn to Dr. Elliott, who will help lead us through the next few slides on our COVID response. Thank you, Dr. Elliott.
Thank you, Chancellor Farabee. Thoroughly investigating incidents where an individual connected to our schools has received a positive COVID test is critical for us keeping our schools open and keeping them safe. And another important part of that strategy is ensuring that folks that test positive also are isolated, and that we're able to provide thorough communications to our families and other folks that are part of that school community. Part of our COVID-19 response protocol is actually divided into 3 phases. Phase 1 is focused on report and isolate. Phase 2, our investigation. And finally, Phase 3 clarifies our steps for notification and quarantine. In the first phase of this work, we talk about reporting and isolating. Typically, COVID cases are reported in the following ways. A student, teacher, or staff member informs the schools that they have taken a COVID test and they have received a positive result, or our students, staff, teachers, or others have received a positive result as a result of participating in asymptomatic testing. In any of these cases, a person that tests positive is required to quarantine for 10 days. They are not able to attend school or come to work for those 10 days. There are some differences that we'll lean into in a moment if a person is actually fully vaccinated, but it's important to note that if a person is testing positive, that if you're vaccinated and you test positive, you still have to quarantine for those 10 days. We are encouraging our families to please notify your schools immediately if your student tests positive. Oftentimes, these results are from tests that take place outside of the school, even though we do have testing available within the school. And we also encourage you to please be sure that you notify any close contacts that are outside of the school community, because that is beyond the reach of what the school is capable of doing. In phase 2 of our protocol, this is the investigation phase. There are really 3 distinct groups that have roles in contact tracing or investigating COVID positive cases. Much of this lift actually lies on the school. The principal, the teachers, they most familiar with the individuals and the routines, so they have a significant role in doing part of that investigation to identify those close contacts. Principals use tools such as their school rolls, attendance rosters, as well as seating charts to be able to clearly identify folks that are impacted. The second group that has a responsibility in our contact tracers and contact tracing is the DCPS COVID response team. This team works with our COVID POCs at the school level to determine and finalize that investigation, to determine those final close contacts. And then finally, DC Health, they have the final role of reviewing the determination of close contacts for each of the schools and verifying that we've done a thorough job with the investigations, and they are able to make any updates or revisions based on their investigation. So when we're thinking about close contacts, just want to give you a couple of reminders. When we are thinking of close contacts for adults to adults or adults to students, we are talking about folks that are closer than 6 feet proximity to an infected, to a COVID positive person during their infectious period, which is 48 hours before the onset of symptoms or a positive test. For students in a classroom where proper mask wearing is in effect and we have other mitigating factors such as good positive ventilation, increased ventilation, in those cases, the close contact definition is folks that are within 3 feet proximity, closer than 3 feet during the infectious period for more than 15 minutes during a 24-hour period. And I'm sorry, I think I may have left off that 15 minutes in the description for the adults. I want to also remind you at this time that if you are a person who is tested positive, you may also receive a phone call from DC Health, from the DC Health contact tracing team. And I want to encourage you, if you do receive a call, please answer the phone. Oftentimes, they are reaching out because there is critical information that they need in order to ensure that all folks that would qualify as a close contact to the case are actually able to receive the notification. So please answer the call if you receive it. And finally, the third step is notify and quarantine. In this step, what happens is our DCPS COVID response team, after talking with the school principal and COVID POC, they provide the final sign-off there that you are now able to make early notifications to impacted individuals. So these are the folks that are considered close contacts. For folks that are fully vaccinated or staff who are, fully vaccinated students or staff who are not exhibiting any COVID symptoms, they do not have to quarantine. However, unvaccinated close contacts will receive instructions to quarantine for 10 days. Our principals sent out a notice to all students, families, and staff that a positive case has been reported on a particular day in their school. In addition to that, DCPS posts community notices of reported cases on our DCPS Reopen Strong website. That, I think, concludes the protocol. I'm going to now turn it over to Jess Jennings to walk us through a few scenarios and show you how that protocol is applied. Jess?
Thank you, Dr. Elliott. So starting with our first scenario, and we wanted to kind of walk through some real-world examples of how these protocols are implemented so you can better understand some of the instructions that you might receive or some of the timelines that you will notice in public communications. So Thomas went to school on Monday, September 13th, and he participated in the school's asymptomatic testing program. And I'll put a plug in that next week we'll be talking more about our testing program in schools, so we hope you tune in then. So Thomas participated, and on Tuesday he received, or his family received, word that he had tested positive through the asymptomatic testing protocol. So what happens next is that Thomas will be held in the health isolation room until his parents come to pick him up from school. School staff will begin working with the DCPS COVID response team to determine the close contacts, and that will be determined using seating charts and school staff observations of who was within the guidelines that Dr. Elliott just walked through of what determines a close contact for both students, staff, and other individuals in the building. Tuesday night, close contacts will be notified by the school that they have been identified as close contacts and they should begin quarantining while the investigation concludes. On Wednesday, formal written communications will go to all identified close contacts, students and staff, and then the school community will also receive a notice about a positive case. That will go out via email and will also be posted on the DCPS Reopen Strong website. So that's scenario one. Moving ahead to scenario two, where we wanted to talk a little bit about the differences in instructions to quarantine for vaccinated students and staff. So Tamika started feeling ill at school on Thursday and exhibiting COVID symptoms. She stayed home on Friday, and on Saturday took a COVID-19 test. When she received the positive test results on Monday, her family notified the school that afternoon about her COVID positive test. On Friday, when she was in class, there was one period of class where she was closer than 3 feet apart from her fellow students. In that class, she sat next to Kelly, Chris, and Serena. In this scenario that we are setting out, Kelly and Chris are not yet eligible to be vaccinated, but Serena is over 12 and vaccinated. So on Monday, Kelly, Chris, and Serena would be notified that they are close contacts for this case at school. For Kelly and Chris, who are not yet vaccinated, they will be instructed to quarantine for 10 days from the last date that Tamika was in the building. Unvaccinated individuals do have the option to take a COVID test on or after day 5 and can return to school if they receive a negative COVID test beginning on day 8. Serena, as a vaccinated individual, does not need to quarantine based off the guidance from CDC and DC Health. However, we recommend that on days between days 3 and 5 that she take a COVID-19 test. In our final step, on Tuesday, the school would be notified that an individual had tested positive who was last in the building on Thursday. And for our final scenario, we wanted to give an example of when a teacher tests positive. So Mr. Perry is a teacher of history at high school. He is vaccinated, but on Wednesday begins having COVID-like symptoms. He stays home on Thursday and decides to take a COVID-19 test and receives a positive test result on Saturday. he was closer than 6 feet to one other staff member, and that person is identified as a close contact. He was not closer than 6 feet to any student. That staff member will be instructed to quarantine if they are not fully vaccinated. The school will also receive a community notice, and an additional email will be sent to the classroom to notify them that a positive test was in that classroom. Please note that that notice will not identify whether a positive individual is a student or a teacher. As he feels well enough, Mr. Perry will teach virtually with a classroom attendant supervising the students. And then after he is isolated for 10 days, he can return to the classroom, provided he has been symptom-free for at least 24 hours. So with that, I want to turn over to my colleague Corey to talk more about the instructional period during quarantine.
Thank you, Jessica. So, of course, it is important that if a student is required to quarantine, that they have access to continue their learning. And so this will take place primarily through asynchronous instruction through our Canvas courses. Those of you that were with us in school last year are familiar with the Canvas courses. This is a place where teachers can post assignments and resources such as videos. They can make notifications and announcements to their students. So during that period of asynchronous time, students will be asked to complete assignments. They may be asked to view videos or access some of our blended learning programs that are available to them. If a significant number of students in a class are all on quarantine, it is possible that that class will shift to a combined instructional model. In that case, the teacher would be providing live instruction in the classroom in person for students who are there, and at the same time, through the use of technology, namely Microsoft Teams and microphones, speakers, and smart boards in the classroom, they'll be able to have the students at home also participate in the learning. And that can take place through viewing assignments or the teacher's board through their screen. They can have conversations with their colleagues. And there are a lot of creative ways our teachers have been engaging students both in the home and at school. When students are learning at home, they will be provided instructions by their teacher about when they should be tuning in for that live instruction. This, of course, is going to vary a little bit depending on the age of the student and the courses. It is important that if your student is requested to quarantine and you need access to a device, that you reach out to your school and they can support you in ensuring that you have both a device and internet access. And on the screen here, you can see the website where you can get more information about Canvas if you need tips on how to access Canvas, how to log in, or any troubleshooting tips. You can find that on the DCPS Reopen Strong website under Resources and Technology. So I'm going to turn it back now to Dr. Elliott to talk a little bit about attendance.
Thank you, Corey. Attendance is still very important, and we want our children to be in school when they are well enough to do so. Want to be able to clarify for you how attendance is recorded in those situations where students are not well enough to attend. So for students who are required to quarantine, but not at the direction of the school district, this could be because a family member has tested positive, and they've been contacted by a contact tracer and told that they need to quarantine. Parents and guardians must provide written documentation of those quarantines. That written documentation should include the date of the COVID-19 exposure, the length of time the student has been directed to quarantine by the medical professional or contact tracer, and the name and organization from who is providing that guidance. So if it's your doctor, then your doctor's name and any contact information. If it's a contact tracer, then you would indicate if that's a DC Health or other contact tracer. Please note that students are required to quarantine students who are required to quarantine at the direction of the school district, they do not need to provide any documentation for the quarantine, as we will be providing a written guidance to students and families with regards to that requirement. Next, I'd like to take just a moment to remind you to take the shot. One of the key strategies for us being able to keep our schools and open and as much as possible is to get as many people as possible vaccinated. That includes our teachers, staff, and other folks that are present in our schools. Also, it includes our young people who are eligible right now to receive vaccinations, and we're hoping to soon see that be extended to lower grades. Currently, DC has 3 youth vaccination incentive sites. Youth who get their first shot at one of these locations before the end of the month, September 30th, can receive iPods or a $51 gift card, and parents who bring their students to vaccination can also receive a $51 gift card. So we want to strongly encourage, if you are eligible, parents, if your students are eligible, please bring your children so that they're able to get vaccinated and have that extra protection. All students who get vaccinated are automatically entered into a sweepstakes, and those prizes will be awarded throughout September and October. And on the screen there's additional information to a website that you can visit to learn more about it.
All
And
right.
I think that concludes our town hall. I think we're moving to questions.
Thank you. And now we're going to move over to the question and answer portion of our program. Just as a quick reminder, if you would like to ask a question, you can press 0 now and you'll be added into our speaker queue. Or if you're joining via social media, you can comment your question on our Facebook and Twitter live streams using the hashtag DCHope. Okay, our first question is going to go to someone on Facebook. Miss Charletta Lucas asked the question about temperature checks, just wanting to know, are all schools required to check temperatures in the morning?
Okay, happy to take the first question. At the guidance of DC Health and the CDC, we did discontinue temperature checks this school year. So that is not part of our protocol. There was evidence that really did not help to ensure the safety of students as they are entering. We are, however, continuing COVID screenings. That is also not required, but the district is making this additional effort. So we do have trained medical professionals, our PCTs, or patient care technicians, that help support entry screening in the morning. And one thing that really helps us to do this quickly, if parents will complete the Ask, Look protocol before sending their students to school. So that the ask is checking to ensure that your student is not exhibiting any COVID-like symptoms, asking and ensuring your student has not been in close proximity of anyone who has tested positive, and then the look piece is a visual screening to make sure your student looks well. So doing that before school is critical, and then when they arrive at school, there is this additional procedure of doing similarly, running through that protocol that happens with our health professionals at the door.
Thank you. Our next question is going to go to the phone lines. Miss Tanisha Thomas, and please forgive me if I mispronounce your name. From Ward 7, Miss Thomas, your line is unmuted. Miss Thomas, can you hear us?
Yes, I can.
Your line is unmuted. You can go ahead and ask your question.
Hi. I have a question. This may be specific to high school or maybe some middle schools, I'm not sure. But I know that during lunch period and in the classrooms, there are assigned seats. So that's not so much as my concern. My concern is in schools where the students have to line up and go through metal detectors or have to stand in line to lock their cell phones away. and especially students that are new to the school where they have not yet gotten to know their classmates, how would you go about contact tracing in those instances, because the students may not know one another, and then they also may not know that another student has tested positive. So how effectively can you contact trace in those instances?
Thank you. I think there are a couple of parts to that question, so I'm hoping I'll get at all of the pieces. If not, please let me know. So whenever we have a situation in a school where we have a positive individual, an individual that's tested positive, our principals and their COVID POCs, each school has identified 2 COVID POCs. They work together to identify close contacts. So they're looking at the seating charts in our schools to determine, where that young person would have been seated. So they're working with that student's teachers to identify who were the students that were in close proximity, and doing our best to be able to identify who those folks were that were closer than 3 feet for more than 15 cumulative minutes. And so those are the key strategies that we use. We did notice, like early at the beginning of the school year, it was a little more difficult for students if they were new and did not know all of their peers that they were, typically around. But as we've gotten into the school year now, 4 weeks into the school year, that's much easier as they kind of know who they might be hanging around in the lunch. Typically, as young people are entering the building, I think you were pointing out students waiting to go through a basement or students who are waiting to put their cell phones away. The thing that we encourage our schools to do is to ensure that young people are not waiting in those lines for a long period of time. Again, the criteria from the CDC and DC Health is that they would have been in close proximity for 15 cumulative minutes within that 24-hour period of time. So the key thing is distance, the distance between those students, 3 feet distance between students as to the greatest extent possible. And then if they are going to be closer than 3 feet, that we're really limiting the amount of time that we don't reach that 15-minute threshold.
Thank you. Our next question is going to come from Facebook as well. Ms. Tracy Parham, excuse me if I mispronounce your name, would like to know if my child is presenting some sort of mild symptom like a runny nose. Is that absence going to be excused?
Sure. We do excuse absences when students are sick. So that has always been a part of what we do in DC public schools. I would note that just having a runny nose by itself is not something that would exclude a student from being able to attend school. So that by itself is not one of the red flag symptoms for COVID. In the protocol that we've sent home to families, posted on our website and communicated in our line with DC Health on, a student would either need to present with one red flag symptom, which would some of those would be fever, difficulty breathing, or 2 of the symptoms. So we just want to encourage parents to review that so you're really clear on what would be a barrier to a student from attending school. And this year, school is significantly different in a time of COVID. So we do encourage students, families, and staff, if you are sick, stay home. That is one of the most important things we can do to risk and mitigate spread of COVID. If you are unwell, do not come to school. And certainly document those absences. Please engage in the online learning as much as possible so your students, young people can stay connected and caught up. But we do encourage you to stay home if you're sick.
And Dr. Elliott, when someone is keeping their child at home because they are sick, COVID or other illnesses, can you remind everyone what they should do, what they need to submit to make sure that absence is documented properly?
All right, great. Thank you for that reminder. So yes, when you do send your student back to school, So say they just had a runny nose and the next day or a day later they were better, you just need to have that written documentation. Now, if your student is displaying multiple subsymptoms or red flag symptoms that would be COVID related, then you would definitely need to follow up with your health care provider and at their advisement probably test and not allow your student to return until you do have a negative COVID test.
Thank you. We've gotten this question a couple of times on social media, but some people are still a little hesitant on receiving the vaccine, and they just want to know who can they chat with to just ease their concerns.
So sure, I would certainly direct people mostly to their healthcare providers. Talk with your healthcare providers. We certainly have quite a bit of information on our DC websites, DC Health website, our DCPS website. There's, lots of evidence out there, the importance of this, the safety of the vaccines. But I believe that your healthcare provider is probably the best person to help present that evidence to you, talk to you about any underlying conditions, and why it would be important for you to consider the vaccination.
Thank you. And then again on Facebook, we have a question from Miss Misty Rubble, and excuse me if I mispronounce your name. She wants to know if I take my student out of the DMV area to more high risk or out of the country, and we still need to quarantine, how do we document those quarantines?
Certainly. So we do have some information on our website with regards to travel. And it is recommended but not required that you quarantine if you leave the DMV. However, if you're going to international travel, there is some specific guidance that's a little more stringent or strict that you do need to follow. Again, we are asking families in those cases to confirm in writing those incidents that your student is missing school. So again, quarantining after travel to a high-risk area is recommended, and a family believes that is the best course of action. Then when their student returns to school, they certainly need to just provide that written documentation of why that child has missed school.
Thank you. Another question is, how can I find information on COVID cases for my school?
Certainly, I can answer that question. Thank you. So on our DCPS Reopen Strong website, which is dcpsreopenstrong.com, you can find a listing of all of the community notices that have been sent out when there is a COVID positive case within our schools. When there is a positive case within our schools, we also email all of our families, so please continue to monitor your emails and look at that website for additional information.
All right, and our last question is going to go back to the phone lines. Miss Laura Berger from Ward 4, your line is unmuted.
Hi there. My question is around what happens when a student needs to quarantine. You said that they could get a negative test after 5 days, and I just wondered if the school provides those tests for students that have been exposed to a COVID positive person, or if families are expected to get their own tests separately. Thanks.
We are working with OSSI, who is our partner for leading our testing in our school. Right now, we have it set up that we are able to test asymptomatic. That means that we are testing in every school at least 10% of the school population every week. We also now have it set up that if a student is symptomatic, so is displaying COVID symptoms during the school day, that we're able to provide testing for that scenario. We are working on the protocol for schools being able to support testing for close contacts. So that has not yet been worked out through our OSSI partnership, but it is certainly underway. So right now, the parents would need to use community resources, and I know the mayor and DC Health has done an incredible job to be sure that there are lots of sites around the city and walking distance to our residents to get those tests, and even available at our public libraries.
Thank you. So it looks like that's all the questions that we have time for this evening. I'm going to go ahead and pass it back over to the Chancellor to close us out.
Thank you so much. Thank you again to the DCPS presenters this evening. I do want to remind our families that we have partnered with Howard University and medical resident students to provide information sessions to students about the COVID-19 vaccine. And we'll ensure that that information is available to families that are interested in gathering more information. As shared tonight, we will continue to strengthen and refine our capacity and protocols as we learn more and as we assess throughout the school year. We acknowledge again that there are some anxieties that families may have or fears, and it is our goal to be responsive accordingly. We're so excited to have all our students back in our building, and we're really pleased that we have a dedicated team that is helping us implement all of our health and safety measures. Thank you and have a good evening.